Hammer toe is a deformity of the toe joints primarily affecting the second, third, fourth or fifth toes. It's caused by the affected toe to bend at the middle joint, resembling the shape of a hammer. The condition can result in pain, discomfort, and difficulty wearing shoes. We're going to talk about the details of hammer toe, including the causes, classification, diagnosis, and treatment in today's video. But before we start the video, if you could just do me a favor and like the video, it really does help the channel to grow and it would be a big favor for me. So the cause of hammer toe, often it's caused by an imbalance in the muscles, tendons and ligaments that hold the toe in its normal position. This imbalance can lead to abnormal contraction or tightening of the toe's muscles and tendons, causing the toe joint to bend. Several factors contribute to the development of hammer toe. So genetics is the first one, so a family history of hammer toes or other foot deformities can increase the risk. Foot structure, high arches or flat feet can contribute to muscle imbalances. The type of footwear, so wearing shoes that are too tight or have a narrow toe box area can force the toes into an unnatural position. And some kind of injury is another type of cause, so trauma or repetitive stress on the toe can lead to muscle imbalances and joint deformities. So we can classify hammer toe into two main types. We have the flexible type, otherwise known as flexible hammer toe. In this type, the toe can still be manually straightened or repositioned at the joint, and the deformity is more apparent when bearing weight. Rigid hammer toe is the second type, and this is when the toe is fixed in its bent position and cannot be easily straightened manually. And this type is more severe and often requires more aggressive treatment. So to diagnose hammer toe, it involves a physical examination by a medical professional, such as a podiatrist or an orthopedic surgeon. The examination will involve observation, so the doctor is going to visually assess the toe position, the alignment, and any signs of any deformities. They'll check the range of motion to check the flexibility of the toe and its ability to move. They'll probably palpate the area, so they may gently manipulate the toe to assess for any tenderness, joint stiffness or deformities, and an x-ray may be taken to visualize the bones and the joints and assess the extent of any deformities. In terms of treatment of hammer toe, it depends on the severity of the condition and the symptoms which may be present, but the treatment options include conservative measures, so this is where the case is mild, so often non-surgical approaches can help to alleviate pain and prevent further progression, and these would include wearing proper footwear, so choosing shoes with a wide toe box and low heels to reduce pressure on the toes, orthotics, which refer to a wide variety of orthopedic footwear. These can include custom-made shoe inserts, which can help correct imbalances and provide support, and toe exercises and stretches to help improve flexibility and muscle balance. Other treatment options include medications, so over-the-counter pain relievers and anti-inflammatory drugs may be recommended to help manage pain and inflammation. Another treatment option can be padding and taping, where pads can be placed on the affected area to reduce friction and pressure. Injection therapy is another potential way to do some treatment, and this involves corticosteroid injections, which can be administered to reduce inflammation and relieve pain. And the final treatment method is some kind of surgical intervention, and this is often in cases of severe deformity or when conservative measures fail to provide relief, and this is some kind of surgical correction, and that's often considered. So these types of surgeries could include a tendon transfer, which is where the tendons are repositioned to correct muscle imbalances, joint fusion, which involves fusing the affected joint to maintain alignment. Joint resection is another type of surgery where they remove a portion of the bone to straighten the toe, and implantation, where they insert a small implant to maintain toe alignment. So we've made it to the end of the video. If you have any questions about hammer toe, leave them in the comment section below. Leave a 100 emoji if you've made it all the way to the end of the video. Make sure you like, comment and subscribe, and thank you very much for watching.